A case 24/2014. A 17-year-old man with severe osteoporosis, and multiple bone fractures. Osteoporosis can be defined as skeletal disorder characterized by compromised bone strength, predisposing on increased risk of fracture in the World Health Organization. Define osteoporosis in adults with the use of BMD criteria. 2. But for children, there is no whole definition of osteoporosis, and the interpretation of BMD measurements is more complex, since the bone size and density changes rapidly with growth. Multiple bone fractures. Primary bone disorders, the occurrence of fractures in early childhood, and the absence of obviously the secondary causes of osteoporosis point to a primary bone disorder. Causes of primary osteoporosis. The idiopathic juvenile osteoporosis is characterized by fractures occurring 2 to 3 years before the onset of puberty, followed by osteoporosis remission several years later. The third, this typical manifestation clearly differs from his patient, since features develop throughout his life without evidence of remission. Therefore, a hereditary disorder of connective tissue is most likely diagnosed for this patient.
The bones are important components which leverage and provide support to the human body. They are composed of calcium, phosphorus, and magnesium. Bones generally hold 99% of the body's calcium. Osteoporosis, or porous bone, is characterized by low bone mass and structural deterioration of bone tissue, which leads to bone fragility and increased susceptibility to fractures of
Background of the patient. The patient had been born to a 73-year-old primigravida mother after 40 weeks of uncomplicated gestation. His mother noted that he had intensely blue hair at birth. Physical examination was otherwise normal. The patient's postnatal course was normal and he was discharged home. When he was approximately 1 year of age, mild delays in speech and gross motor development were noted by his patients and pediatrician, including weakness in the leg muscles and poor body control. He began walking to 16 to 17 months of age and shortly thereafter had the first of multiple fractures. The medical history. The medical history was obtained from the patient and his mother. He had asymptomatic hypothyroidism, hypercholesterolemia, and vitiligo. He reported pain which he had rated to a scale of 0 to 10, with 10 indicating the most severe pain, muscle cramps in growing his knees and weight bearing, occasional pain in his upper body, and occasional palpitation. In the past, he had bleeding and infection to the toenails after cell-induced trauma, as well as induced acid reflux. He had no history of hearing loss, joint dislocation, retrophiliasis, eating disorder, lactose intolerance, or celiac disease. Medications include vitamin D3, atorvastatin, and levothyroxine sodium. He had no known allergies.
Two essential cells are involved in the daily turnover of the bone: osteoblast cells and osteoclast cells. Overactivity of the osteoclast cells leads to osteoporosis.
Differential diagnosis. Dr. Michael Madsen, the history of 27-year-old man is more notable for numerous fractures that have occurred since early childhood and recent BMT assessment with the use of DEXA revealing severe osteoporosis. Since the problem of multiple bone fractures and osteoporosis is the major feature in this case, I will construct many differential diagnoses around bone fragility and will use some of the other findings, including unjunctional facial features, pale blue sclera, discolor, and white space dentition, and joint laxity to narrow the list of possible diagnoses.
There are two types of osteoporosis: primary and secondary osteoporosis. Primary osteoporosis is in turn divided into type 1 and type 2. Symptoms of osteoporosis are swelling and joint pain, fracture, disfigurement and debilitation, and kyphosis. Osteoporosis can be diagnosed by bone densitometry, ultrasound, and by quantitative computed tomography. Osteoporosis can be treated by changes in lifestyle, like quitting smoking, regular exercise, a balanced diet, and by taking medications such as estrogen replacement therapy, biphosphonates, alendronate and risedronate, or synthetic calcitonin or parathyroid hormone supplements.
Thanks.